There are 71 new local cases of coronavirus in our state. 49 of those are linked to known outbreaks. 22 cases have their acquisition source under investigation by our public health team. At least 16 of those were in isolation for the entirety of their infectious period, but obviously 16 out of 71 is a significant concern to us. Jerome will speak more to that kind of epidemiological and outbreak map, and with particular focus on Shepparton and some other inner western suburbs that are a challenge for us. 29 people are in hospital, 9 of those are in intensive care, and 5 are on a ventilator. We obviously wish them well, and we send our best wishes to the dedicated teams of nurses and doctors and others that are treating them, and indeed all of our health team, from AMBOs who are transporting patients all the way through to cooks and cleaners, ward clerks. All of them are doing an amazing job, and so much of this strategy is about preventing a situation where they are given an impossible task, where they are given thousands and thousands of patients to treat when that is simply not possible. One of the most challenging things I'm sure that the New South Wales government and the community in New South Wales are facing at the moment, because we've been there, we were there last year, to have 400, 500, 600 patients admitted is really, really hard. And I think later this week we're going to have a couple of nurses who nursed right through that really challenging second wave in Melbourne, and they might, I think, remind us all in very powerful terms of just how challenging that is, even with 500 patients, let alone when we start adding zeros. Many thousands of patients will overwhelm all of us. So we not just send our best wishes and thanks to our staff here in Victoria who are doing an amazing job, but also to those staff in New South Wales who must be working under extremely difficult conditions and circumstances. That means there's a total of 494 active cases across Victoria. Very pleasingly, 46,446 test results came to us overnight, so the vast majority of those were done yesterday, as we're getting everybody's results to them, 99% of them the day after. So I'm very grateful for a Sunday, that's a very strong number, and I'm very grateful to all of those who came forward and got tested. Thank you so much. To the 22,191 Victorians who got vaccinated yesterday, thank you as well. That's a very powerful contribution and a very strong number again for a Sunday. In fact, we had our biggest week in state clinics last week, 186, just shy of 186,000 jabs last week. And again, thanks to not only those who came and honoured their appointments and came forward, but thanks also to all the staff who make that possible in a safe way. Now, to that end, I can report today, just as I did on Saturday, and this will take me a little while, but I think it's worth spending time on it. There's 52,566 vaccination appointments available over the next 7 days. Just to give you an example of where those appointments are available, because it'll hopefully trigger people to act and go onto the website and book an appointment right now. At the Ford factory in Geelong, there are more than 4,800 appointments over the next week. At Sandown Racecourse, 3,300. Wyndham Civic Centre, there's about 1,000 appointments available over the next week. In Melton, 4,700 appointments. At the Melbourne Convention and Exhibition Centre, there's some 4,000 appointments. At the Showgrounds, Melbourne Showgrounds, there's some 2,200 appointments available. Plenty Ranges Arts Centre in South Morang, there's some 2,300 appointments. And there's also 1,700 appointments approximately available at Frankston's Bayside Centre. It's not just about Melbourne though, and Geelong, it's right throughout our state. So to give you a couple of other examples for regional Victoria, Wonthaggi Town Hall, there's about 865 appointments available there over the coming week. The Wodonga Vaccination Hub, there's just under 800. And at Shepparton Showgrounds, there's some 300, just a little bit above 300 appointments available over the next week. So there are both Pfizer and AstraZeneca appointments available right across the state. Please go online, please book an appointment with confidence, please turn up, get that first dose, and for those who've had a first dose, please be vigilant around getting your second dose on time. Each and every one of those visits, each and every one of those appointments takes us a step closer in that race to 70 and then 80% of our community having been vaccinated. That means that we don't have to be locked down, certainly not statewide. We don't have to have many of the rules that are essential and our only option at this time. those vaccination numbers give us many other options, and they're all much better than the very limited set of options that every state and the national government have reluctantly and with a heavy heart had to sign up to. This strategy is a National Cabinet strategy. If we had other options, we would of course use them. And I just want to take in recognition of the fact that this is a partnership between our government and the Commonwealth Government. I want to thank the Prime Minister and the Federal Treasurer for their equal part in now, I think, the fourth or maybe even the fifth set of business supports that were announced yesterday, with a strong focus on regional Victoria, given the regrettable decisions we had to make on Saturday.